everyone. Today we will be discussing about the SSRIs, that is selective serotonin reuptake inhibitors. So first, which is very important thing, is that never use, never give, never administer SSRIs with the MAOIs, as when we will give the combination of these both, it will cause the hypertension crisis. And if hypertension crisis occur due to combination of these both administration, then for this purpose we will give the cyproheptadine, which is one type of antidote for this type of toxicity. Then, what is the mechanism of SSRIs? Mechanism of SSRIs is that normally serotonin and norepinephrine, these both are responsible for the depression, as their in their uptake reduces, which causes the depression. So, in order to let the serotonin pass to this postsynaptic receptor, postsynaptic neurons, we need to break this blockage, which is impeding the transfer of serotonin from presynaptic neuron to postsynaptic neuron. For this purposes, as we are studying about the selective serotonin reuptake inhibitors, we want to only pass serotonin, then we will selectively block those inhibitors which are impeding the transfer of serotonin. So then what will happen? Serotonin will pass into postsynaptic neuron, and then mood will elevate. Mood will elevate. Person will get into the happy mood. Finally, depression symptoms will reduce. Now we will be discussing about what all are the examples, or what all drugs come in the SSRIs. First one is fluoxetine. Fluoxetine, what points you have to discuss for the exams like NORCET and NCLEX, which are very important points. Fluoxetine, you must remember that it is the drug of choice in OCD and bulimia nervosa. And next is fluoxamine, then is paroxetine. Paroxetine, you have to remember this wire trick: P for premature, E for ejaculation. This drug is used for the treatment of premature ejaculation. Then citrum, then ceterine. This is the drug of choice in the depression and PTSD patients. And what are its side effects? Ceterine have certain side effects, that is, this drug reduces the libido and cause the sexual dysfunction in the patients. The next one is acetylopramine, then prime, then this viproprine. Viproprine, there is one side effect where it is used. Basically, it is drug of choice in the cigarette smoking patients. We use this drug in the cigarette smoking patients. Then there are some more important points which you must know about the selective serotonin reuptake inhibitors. They are like, first one are complications. So complications you have to remember is serotonin syndrome, that we have already discussed here, that it causes the this causes the hypertension crisis when both are given up together. So what are the final symptoms we will notice if the serotonin syndrome will occur? That will be agitation, confusion, hallucinations, tremors, sweating, and hyperthermia, that is fever will occur, temperature will increase of the body. It is the high alert emergency. We have to immediately notify the doctor. And one more thing which you must remember about this serotonin reuptake inhibitors administration, that is, whenever we have to start the SSRs of the patient, then what must will be considered is that patient should have the MOAIs clearance. That is, we have to stop 14 days before MOAs 14 days before serotonin inhibitors and 14 days after the release, then we will go for the MAOI. Means whenever we have to start the treatment of SSRIs, there should be the clearance in the body. There should be no MOAIs in the body. That is, we have to stop these 14 days before and 14 days after the administration of SSRIs. Then we have to check suicidal ideation risk. Then withdrawal syndromes. We have to stop this drug by tapering down. Do not stop abruptly. There, weight changes will occur. One thing you must know is that initially weight loss will occur. Then after long term, only weight gain will occur. Usually what happens in antidepressants, we notice the weight gain. But here, once you remember the point is that initially weight loss can occur. Then for the long-term chronic condition, weight gain can occur. Then sexual dysfunction is very commonly seen with the SSRIs. We have to teach the patient that it is a common side effect of this drug. Then there are some critical interactions which you have to remember. That is Son, John Watt, MAOIs, and SNRIs, and Buscarine. We have to not give SSRIs with them as they will cause serotonin syndrome. Then TCN and lithium levels will also elevate. SSRIs will elevate their levels. So we have to check the toxicity levels. Then anticoagulants and antiplatelets we do not administer with the SSRIs as they significantly increase the risk of GI bleeding. So we do not give them together. For more, subscribe the channel and watch the